7 medications that damage your heart. We are back with another informational video that can help you save your heart. You know, medications can do wonders for our health, but did you know that some of them might be sneaking in a few unwanted side effects, especially when it comes to your heart? It's true! In this video, we're going to talk about 7 common medications that could potentially put a strain on your heart. Don't worry, though, we'll break it all down with facts and studies so you can stay informed and keep your heart in tip-top shape. Let's dive in. 1. NSAIDs. When it comes to managing pain, non-steroidal anti-inflammatory drugs, or NSAIDs, are some of the most popular options out there. Medications like ibuprofen, Advil, Motrin, and naproxen, Aleve, are commonly used to tackle everything from headaches to arthritis pain. They work by reducing inflammation and relieving discomfort, making them a go-to for many of us. But while these medications are effective, they can also come with some hidden risks, especially when it comes to your heart. NSAIDs work by blocking chemicals in the body called prostaglandins, which are involved in causing pain and inflammation. However, prostaglandins also play important roles in protecting the stomach lining and maintaining blood flow to the kidneys. This is where the potential problems start. One of the most significant concerns with NSAIDs is their link to an increased risk of heart attack and stroke. Studies have shown that even short-term use of these medications can raise your risk. It was found that the risk of heart attack can increase by up to 50% within just a few weeks of NSAID use. This risk is even higher for people who already have heart conditions or other risk factors like high blood pressure or high cholesterol. In addition to the risk of heart attacks, NSAIDs can also lead to heart failure, a condition where the heart struggles to pump blood effectively. These medications can cause your body to retain sodium in water, which increases blood volume and puts extra strain on your heart. Research from the European Heart Journal found that people taking NSAIDs were 19% more likely to be hospitalized for heart failure compared to those who didn't use these drugs. This is especially concerning for people who already have heart issues or are at risk for developing them. Another issue with NSAIDs is their effect on blood pressure. These drugs can cause your kidneys to hold onto more sodium, which in turn raises your blood pressure. High blood pressure is a major risk factor for heart disease, as it forces your heart to work harder to pump blood, potentially leading to long-term heart damage. For people with existing high blood pressure, this can be particularly dangerous. NSAIDs can also affect the formation of your blood clots. While they might reduce the risk of clots that can lead to heart attacks and strokes, they can also increase the risk of bleeding, especially in people who are already taking blood-thinning medications. This makes it even more important to be cautious when using NSAIDs, particularly if you have other health conditions or are on multiple medications. If you rely on NSAIDs for pain relief, it's important to be aware of these potential risks and take steps to protect your heart. First, try to use these medications only when necessary and for the shortest time possible. It's also worth exploring other pain relief options, such as acetaminophen, Tylenol, physical therapy, or lifestyle changes like improving your diet and getting more exercise. Keeping an eye on your blood pressure and heart health is also crucial, especially if you use NSAIDs regularly. And, of course, if you have any concerns or a history of heart problems, it's always a good idea to talk to your doctor about safer alternatives. 2. Chemotherapy drugs. Did you know that some chemotherapy drugs, while powerful against cancer, can also take a toll on your heart? Medications like doxorubicin, adriamycin, and trastuzumab, Herceptin, are highly effective at attacking cancer cells, but they can sometimes weaken the heart muscle in the process. This makes it harder for your heart to pump blood efficiently, leading to a condition called cardiotoxicity, where the heart's function becomes compromised. Curious how these life-saving drugs impact your heart and what can be done about it? Let's break it down. Studies have shown that a percentage of people who undergo treatment with these chemotherapy drugs may develop heart-related issues, including congestive heart failure. Congestive heart failure occurs when the heart cannot pump blood as well as it should, leading to symptoms like shortness of breath, fatigue, and swelling in the legs. For example, research has found that up to 20% of patients treated with doxorubicin may experience some form of heart damage, and the risk increases with higher doses and longer treatment durations. Trastuzumab, often used to treat certain types of breast cancer, is another drug that can impact heart health. It's particularly concerning for patients who already have risk factors for heart disease or who are receiving it in combination with other potentially cardiotoxic chemotherapy drugs. While the heart issues related to trastuzumab are often reversible once treatment ends, they still pose a significant concern during therapy. If you or a loved one are undergoing chemotherapy, it's important to be aware of these potential risks. Oncologists typically monitor heart function closely before and during treatment with these drugs to catch any signs of heart damage early. Regular heart checkups, such as echocardiograms, can help detect changes in heart function, allowing doctors to adjust treatment plans if necessary to protect the heart while still effectively fighting the cancer. 3. Corticosteroids. Are you on corticosteroids like prednisone for allergies or chronic conditions? While these medications are great for reducing inflammation and controlling symptoms, long-term use can come with some serious risks for your heart. Want to understand how these drugs might affect your heart health and what you can do to manage these risks? Let's explore. One of the main concerns with long-term corticosteroid use is its impact on blood pressure. These drugs can cause your body to retain fluid and increase sodium levels, leading to higher blood pressure. High blood pressure is a well-known risk factor for heart disease, as it forces your heart to work harder and can contribute to heart damage over time. In addition to raising blood pressure, corticosteroids can also lead to increased cholesterol levels. Elevated cholesterol is another risk factor for heart disease and can contribute to the buildup of plaque in the arteries, potentially leading to heart attacks and strokes. Research has shown that long-term use of corticosteroids can significantly raise the risk of cardiovascular problems. A study published in the Journal of the American College of Cardiology found that patients on prolonged corticosteroid therapy had a higher incidence of heart attacks and strokes compared to those who were not. Fluid retention caused by corticosteroids can further strain the heart. When your body holds onto excess fluid, it increases the overall volume of blood circulating through your system, adding extra pressure on the heart and potentially leading to heart failure in severe cases. If you're taking corticosteroids, it's important to keep an eye on your heart health. Regular checkups with your healthcare provider can help monitor your blood pressure, cholesterol levels, and overall cardiovascular health. Your doctor might recommend lifestyle changes, such as a heart-healthy diet and regular exercise, to help counteract some of the side effects of corticosteroids. They might also adjust your medication dosage if necessary to minimize risks. 4. Diabetic medications. Now, let's talk about diabetes medications, specifically thiazolidinediones like rosiglitazone, Avandia, and pioglitazone, Actos. These are commonly prescribed to help control blood sugar levels in people with type 2 diabetes. But did you know that, while these medications are effective at managing glucose levels, they also carry some risks for heart health? It's important to be aware of these potential side effects and how they might impact your overall well-being. Let's dive into what you need to know. One of the main concerns with thiazolidinediones is their association with an increased risk of heart failure. Studies have shown that these medications can lead to fluid retention in the body. When excess fluid builds up, it can put extra strain on the heart, making it harder for the heart to pump blood effectively. This is particularly risky for individuals who already have existing heart conditions or who are at higher risk for heart disease. Research published in the New England Journal of Medicine found that rosiglitazone was linked to a higher incidence of heart failure compared to other diabetes medications. Similarly, pioglitazone has been associated with an increased risk of heart failure and fluid retention, as highlighted in studies published in the Journal of the American College of Cardiology. These studies reveal that patients using these drugs may experience swelling in the legs and ankles, as well as symptoms like shortness of breath and fatigue, which are indicators of heart strain. If you're taking thiazolidinediones, it's crucial to monitor your heart health closely. Your doctor may recommend regular checkups to keep an eye on your heart function and fluid levels. In some cases, they might suggest alternative diabetes medications that have a lower risk of heart-related side effects. 5. Amphetamines. Are you or anyone you know taking amphetamines for ADHD or narcolepsy? If yes, you should probably be aware of the facts and evidence we have given you. While these medications are excellent at managing symptoms with their stimulating effects on the brain, they can also have a notable impact on your heart. Curious about how these drugs might affect your heart health and what you should be aware of? Let's dive into the details. One of the main concerns with amphetamines is their effect on heart rate and blood pressure. These medications can cause both to increase, which puts additional strain on your cardiovascular system. Over time, this can lead to heart rhythm problems, also known as arrhythmias, and in severe cases, it can contribute to more serious heart events like heart attacks or strokes. Research has shown that people taking amphetamines may be at a higher risk for sudden heart-related issues. A study published in the Journal of the American College of Cardiology found that amphetamine use was associated with a higher incidence of cardiovascular events, including heart attacks and strokes, particularly in individuals with pre-existing heart conditions. Another study in the New England Journal of Medicine highlighted that amphetamines could lead to significant increases in blood pressure and heart rate, which can exacerbate underlying heart problems. If you're prescribed amphetamines, it's important to keep a close watch on your heart health. Regular checkups with your healthcare provider can help monitor your blood pressure and heart rate to ensure that they remain within safe limits. 6. Tricyclic antidepressants. Before talking about the next medicine, first let us know that are you aware that antidepressant medications are quite common, with millions of people around the world relying on them to manage depression and mood disorders? For instance, it's estimated that over 16 million adults in the U.S. have been prescribed antidepressants in recent years. While these medications, including tricyclic antidepressants, TCAs, like amitriptyline and nortriptyline, can be effective at improving mood and alleviating symptoms, they also come with potential risks for your heart. Curious about how these medications might impact your heart health? Let's dive into the details. One of the main concerns with TCAs is their effect on the heart's rhythm. These medications can alter the way your heart recharges between beats, a process known as the QT interval. Prolonged QT intervals can lead to dangerous heart rhythms, known as arrhythmias, which can potentially cause serious heart issues. This risk is particularly notable when TCAs are taken in high doses or when combined with other medications that affect heart rhythm. Research has highlighted the potential cardiovascular risks associated with TCAs. A study published in the American Journal of Psychiatry found that high doses of TCAs were linked to an increased risk of sudden heart problems, including arrhythmias and heart attacks. Another study in the Journal of Clinical Psychiatry confirmed that TCAs can cause significant changes in heart rhythm, especially in patients with pre-existing heart conditions or those taking multiple medications. If you're prescribed TCA, it's important to be aware of these risks and to monitor your heart health regularly. Your healthcare provider might recommend periodic heart evaluations, such as an electrocardiogram (ECG), to check for any changes in heart rhythm. 7. Proton pump inhibitors, PPIs. Are you taking proton pump inhibitors, PPIs, like omeprazole, Prilosec, for acid reflux or stomach ulcers? These medications are effective at reducing stomach acid and easing heartburn, with around 15 million Americans using them annually. However, recent studies suggest that long-term use might have some unexpected consequences for your heart. Curious about how this common treatment could impact your heart health and what you should be aware of? Let's dive into the details. One concern with extended PPI use is its potential link to an increased risk of heart problems. Some studies suggest that taking PPIs regularly could slightly raise the risk of a heart attack. Research published in the Journal of the American Medical Association found that people using PPIs over a long period had a modestly higher risk of experiencing a heart attack compared to those not using these drugs. This risk might be related to how PPIs affect blood vessel function. PPIs can alter the levels of certain substances in the blood that are important for keeping blood vessels healthy, which could potentially impact heart health. Another issue is that PPIs can interfere with the absorption of essential nutrients, such as magnesium and calcium. Low levels of magnesium and calcium can have indirect effects on heart health, contributing to issues like high blood pressure and irregular heartbeats. Studies have found that long-term PPI use can lead to deficiencies in these nutrients, which may further increase cardiovascular risks. If you're using PPIs, it's important to use them as directed and to discuss any concerns with your healthcare provider. They may recommend periodic evaluations to monitor your heart health and assess whether you still need to take the medication long-term. Additionally, exploring alternative treatments or lifestyle changes for managing acid reflux and ulcers might help reduce the need for prolonged PPI use. In conclusion, it's crucial to stay informed about how different medications can impact your heart health. While these drugs are essential for managing various conditions, being aware of their potential side effects on your cardiovascular system are key. If you're taking any of the medications we've discussed, make sure to discuss your heart health with your doctor. Regular checkups and open communication can help catch any issues early and ensure your treatment plan is as safe as possible. Don't hesitate to ask about alternative options if you have concerns, and be proactive in monitoring your health. By taking these steps, you can protect your heart while effectively managing your overall health. If this video helped you, make sure to like, share, and subscribe for more easy-to-understand health tips. Stay healthy and informed.